Thank you for reviewing the 2016 Employee Benefit Program for Classic Auto Group. Open enrollment will be held from November 9th through the 23rd, 2015. The elections you make during open enrollment will go into effect on January 1st, 2016 and will remain in effect until December 31st, 2016. You will not be able to make changes to your elections unless you experience a qualified life event listed here on the screen. If you have one of these qualified life events, you need to notify HR within 30 days of the event in order to make changes. If you don't notify them within 30 days, you will not be able to make changes until open enrollment next year.
Let's review what's not changing for 2016 first. Classic Auto Group will continue to offer affordable medical plan options for you. Your Cigna dental plans and rates will not be changing. Your Cigna vision plan and rates will not be changing. And Classic Auto Group will continue to provide to you life and AD&D coverage through Cigna at no cost.
What is changing for 2016? Well, first of all, we will have online enrollment through a system called Benefits in Hand. We're changing our medical carrier from Cigna to United Healthcare. We will have a new plan option, and the new plan option will be our base plan. The EAP will be moving to Care24 through United Healthcare, and we will have a wellness program called Simply Engaged through United Healthcare. Our online enrollment tool, Benefits in Hand, is a new way to enroll. No more paper. It's an easy, intuitive enrollment platform, and all benefit-eligible employees must log in to elect your plans. If you are waiving coverage, you must log in and decline. You can access Benefits in Hand from home or from work. There will be a detailed instruction list in your benefit guide. Once you log into the system, we need every employee to verify all of your personal information. And as an FYI, we will need to verify your Social Security numbers and dates of birth for all covered members, so please have those handy when you enroll. If you have any questions about your benefits or need help enrolling after the presentation, please call the Employee Response Center at 866-419-3519. They're available to take your call Monday through Friday, 8 to 5. And if you don't have access to a computer, they can actually make your elections for you. Once you're a United Healthcare member, the best thing you can do is register on myuhc.com. This is your personalized online portal. You can make customized searches for network physicians in your area. There's integrated online access to all of your benefit coverage for medical and pharmacy. There are tools to help you understand your benefits, track and manage your claims, safely record and organize your family's medical history. You can also chat online with a nurse, estimate your healthcare cost, engage in their interactive wellness program, and earn gift cards. United Healthcare has lots of tools to help you manage your health and your plan, both online and on the go. myuhc.com, Rally, and Health for Me, which is their app for Android and iPhone. The United Healthcare Health for Me app is a great way to get connected. There's useful information. You can view and share your health plan ID cards via mail, email, or fax. You can check your account balances and benefit amounts, collect, track, and share past and current personal health records, and view and sort and save claim information. New this year, you can actually pay medical bills with a credit card or debit card or health savings account through the online app. You can estimate costs of common procedures and know your costs up front. You can find nearby providers, hospitals, quick care facilities, convenience care facilities, and you can connect with the nurse line 24/7. United Healthcare has premium designated physicians. They call them premium Tier 1 providers. When you search on myuhc.com, these providers are going to appear in your list first. These are physicians in 27 different medical specialties who are recognized for meeting national standards for quality and local benchmarks for cost and efficiency. When you use your medical plan, in some instances, you will save money when you use a Tier 1 premium provider in your copay. With United Healthcare, there is no need for you to choose a primary care physician. You can go to a specialist as you see fit. But consider having a primary care physician because they can be helpful in managing your care. And just as a note, preventive care is covered 100% on all plans offered to you. The most common question I get is, which plan is best for me? Well, this is really a personal question. When we go through our plan options, be thinking about how much you'll pay in premium for the plan, and your rates will be in benefits in hand. Preventive care is covered in full on all 3 plans. You don't have to have referrals to see specialists on any of the plans. Consider how often you actually see the doctor. How often you need specialist visits. Are you taking ongoing medications? How likely are you to have services that are applied to your deductible? Is your doctor in the Choice Plus or Choice Network? And as a note, these are actually the same network. The Choice plan has no out-of-network benefits. The Choice Plus plan is the Choice Network Plus out-of-network coverage. And then think of, do you need the flexibility to go out-of-network? Or is the Choice Network sufficient for you?
In 2016, you will have 3 medical plan options through United Healthcare. Your most affordable plan will be the Flex Zero plan. United Healthcare is also offering 2 very similar plans to what you have today. Your network is the Choice or Choice Plus network, depending on which plan you choose. Let's talk about the Flex Zero plan first, because it's a little bit different. When you need to go see a physician, either a specialist or a primary care type physician, you have 3 visits that you don't have to pay anything for. Once you have exhausted those 3 visits between a primary care specialist, after that you have to meet a calendar year deductible and then co-insurance. The deductible on this plan is $3,000 for an individual and $6,000 total for your whole family. The plan covers everything at 80% after that, and you pay 20%. You can rest with peace of mind knowing that even if you have a catastrophic illness, the most that you'll pay out of your pocket is $6,850 for an individual or $13,700 for your entire family. Keep in mind, preventive care is always covered at 100%. For outpatient lab and x-ray, those will apply towards your calendar year deductible. After you've met that, everything will be covered at 80% and you'll pay 20%. Complex imaging, inpatient hospitalization, outpatient surgery, emergency room, all have a separate $250 copayment per occurrence, and then you have to meet your deductible and then co-insurance applies. As an added benefit, you also have 2 urgent care visits at no cost each year for each person covered under the plan. Once you exhaust those 2 visits, then your next visit would be applied towards your deductible if you've not already met it. And after you've met it, then you would only pay 20%. There are no out-of-network benefits for the Flex Zero plan unless you have a true emergency. Both of the PPO plans have a deductible. The base PPO is $4,000 for an individual and $8,000 for a family. The co-insurance is 70%, so you'll pay 30% after you meet your deductible. The most that you'll have to pay out of your pocket in a calendar year would be $6,350 for an individual or $12,700 if you're covering more than one person. If you need to see a physician on this plan, your copayment is $40. If you need to see a specialist on this plan, if you see one of the premier specialists, your copayment is still $40. If you choose a specialist that's not a premier specialist, your copayment is $60. Your preventive care, of course, is covered at 100%, and so is your outpatient lab and x-ray in the physician's office. Everything else would have to apply to your deductible, and once you meet your deductible, everything's covered at 70% and you pay 30%. Emergency room does have an additional $200 copayment plus your coinsurance. Urgent care is covered at a $75 copayment. Now that's your in-network benefits. On the Choice Plus plans, you're able to go out-of-network. You'll see that the out-of-network benefits are half as good as the in-network benefits. So your deductible out-of-network is $8,000 for an individual and $16,000 for a family, and then everything else is covered at 50% until you've paid a maximum of $15,000 for an individual or $30,000 for a family. You can see it's always most cost-effective to choose providers within the network. One other thing, if you go out-of-network on either of the PPO plans, the reimbursement for a non-network provider is based on a percentage of Medicare. So if your non-network provider charges more than that, you're going to be responsible for the difference. The Buy-Up PPO plan has a $2,000 deductible for an individual and $4,000 for a family, and then everything is covered at 80% and you pay 20%. The most that you'll have to pay out of your pocket on this plan is $4,000 for an individual or $8,000 for a family. Your office visit copay for a non-specialist is $25. For a specialist, if you see a premier specialist, your copayment is still $25. However, if you choose a specialist that's not in the premier network, then you will be spending $50 for a visit. Preventive care is still covered at 100%. And your complex imaging, hospitalization, outpatient surgery, all would apply to your deductible and then covered at 80% and you pay 20%. Emergency room on this plan is just a $200 copayment, and urgent care is a $75 copayment. Again, you can see that out-of-network you're going to pay more out of your pocket, and always remember that the out-of-network reimbursements that United Healthcare makes will be based on 110% of Medicare charges, and anything over that your provider bills will be your responsibility.
United Healthcare covers prescriptions a little differently. I know you're probably used to generic name brand, non-preferred name brand. What United Healthcare does is they have Tier 1, Tier 2, Tier 3, and Tier 4, and that's really just based on the cost of the medication. Tier 1 is your lower cost, Tier 2 mid-range, Tier 3 is higher cost, and Tier 4 is the highest cost. If you choose medications in the lower tiers, it may save you money. On the Flex Free EPO, Tier 1 is $20, Tier 2 is $50, Tier 3 is $85, and Tier 4 is $250. On the base PPO, it's the exact same amounts. On the Buy-Up PPO, your Tier 1 drugs are only $15, Tier 2 $40, Tier 3 $75, and Tier 4 $200. You can find the prescription drug list on myuhc.com or the United Healthcare website. We are preparing an additional video entitled Everything You Need to Know About United Healthcare. Please view that for more information on all of these programs because they are very important to you and they're benefits that you have that will not cost you. First of all, premium designated doctors, Care 24, which is their EAP, their 24/7 nurse line, virtual physician visits. You can access a doctor online through your smartphone or computer and not have to go to the doctor. They have a healthy pregnancy program, health discounts up to 25% on services not covered by the health plan, gym membership discounts, and you can also learn how to earn gift cards up to $200 for yourself and an additional $200 for your spouse. And there's a snapshot of some of the gift cards that are available. If you get a phone call from United Healthcare, the first question is, why are they calling me? Well, the biggest thing is to help you. Please answer your phone because they have some important information they want to share. They may be contacting you after you've left the hospital and know that you need follow-up treatment and want to make sure that that care has been coordinated for you. or if there's certain medications that you need, they want to make sure that you get that in order to keep you from relapsing and having to go back into the hospital. They also have programs under disease management where they have nurses review your clinical history, and if there's an issue with maybe how your diabetes is being managed, or if you have coronary artery disease, they may try to help educate you and give you tools to help you manage that disease so that you can live a healthier, more productive life. Their healthy pregnancy program, they call for you on that once you have a diagnosis, and then at times a pharmacy may reach out to you and see if you have any questions on your prescriptions or notify you if there's a contraindication on something you've been prescribed. Your dental options are not changing. You have 2 PPO plans from Cigna and a DHMO. Your 2 PPO plans are on this slide. There's an annual maximum benefit, and it's the same on both plans. It's $1,250, and what that means is that's the most that Cigna will pay in benefit in a calendar year for each covered person on the plan. For preventive services on both plans, they're covered at 100%, and you do not have to meet your deductible for these. But if you have basic services, fillings, and diagnostic work that you need done, under the core PPO plan, that is covered at 80% after your deductible. And on both plans, your deductible is $50 for an individual, but if you're covering more than 3 people, only 3 people would have to meet that. On the buy-up PPO, basic services are covered at 80% after deductible, but basic services on this plan includes endodontics and periodontics. So if you know you're going to need major work done, root canals, gum disease, the buy-up plan would be the best plan for you. And then your major services on both plans are covered at 50% after deductible. The core plan, this is where your endodontics and periodontics fall. So if you're having a root canal on the core plan, it's only covered at 50%. If you're having that same root canal on the buy-up plan, it will be covered at 80%. And the other difference between the plans is orthodontics. Orthodontics is not covered at all on the core PPO plan. On the buy-up PPO plan, it is covered at 50% after deductible, but for dependent children only. So if you have children needing orthodontics, or if you're likely to have root canals, or if you have gum disease, the buy-up option will be the best plan for you. If you don't have any of those issues, the core plan would definitely be sufficient. The DHMO is a dental HMO. You have to pick a dental provider in the DHMO network, and you have to go to that provider for all of your care. They have to refer you if you need a specialist, and they're the only provider you can see in order to have coverage. If you go to another provider outside of your assigned dentist, you will not have coverage. So this plan is very restrictive, but it has very rich benefits. You'll see that there's no annual maximum benefit. There's no calendar year deductible. This plan, you pay a copayment for each and every procedure that you have. And if you have 5 procedures in a day, you'll pay the copayment for each one of those procedures, and they'll add up one over the other. I have some sample copays here, but we do have a full fee schedule that lists all the eligible procedures that you will want to review before enrolling in the plan. Under preventive services, your oral evaluation, bite wing x-rays, semi-annual cleaning are all at no charge. If you need sealants, that's $12 per tooth. Under the basic services, a 2-surface silver filling is no cost. A 1-surface white filling anterior tooth is no cost. Removal extraction of an erupted tooth is only $12. And surgical removal of an erupted tooth is only $53. For major services, if you have a porcelain crown, it's $4.90. A molar root canal is $3.35. So if you have a root canal, chances are you're going to have to also have a crown, so you'll want to add those together to know your total cost. And then periodontal scaling and root planing has limitations, but that's $83. The orthodontic coverage on the dental DHMO is $2,040 for the entire course of treatment for children up to age 19. Adult copayment is slightly higher, but there is coverage for adult orthodontia on this plan where there's not on the PPOs. Again, please see the complete schedule of services. The 2016 Cigna Vision Plan is not changing. You have in and out of network benefits available to you. When you see a network provider, you definitely get the biggest benefit. And providers can be found on mycigna.com. You can get your examination, lenses, and frames every 12 months. If you're going to get contact lenses, those are in lieu of frames and lenses, so you can't get contact lenses and lenses for your frames in the same year. Your exam copayment is $10 and your materials copayment is $25. The frame allowance is $130, so when you go to a participating provider, you can get any frame in there up to $130 covered under your copayment. But if you choose frames that are more expensive than $130, you'll get the $130 allowance, and then you'll get a discount off the amount over that. Contact lenses are covered in full after your copayment, and the allowance for disposables is $110. If you go over that, you can get discounts on additional purchases. And then if you decide to go out of network, then you'll get reimbursed up to the limits on the screen. Classic Auto Group provides you basic life and AD&D at no cost. Benefits do end at termination of employment or retirement. We are asking everyone to please make sure you have beneficiary information in the new online enrollment system, Benefits at Hand. But your basic life coverage is $15,000 and another $15,000 if the death is due to an accident. You also have an accelerated death benefit, so if you're diagnosed with a terminal illness, you can actually file for early payment of your claim. And there are age reductions, 65% at age 65 and 50% at age 70. Thank you for taking the time to learn about your benefits this year. If you have any questions about your benefits or need help enrolling, call the Employee Response Center at 1-866-419-3518. They're available to take your call Monday through Friday, 8 to 5. Or you can email them at helpline@higginbotham.net.